This is a recent patient case study that came into the office. She's had some knee pain on and off through a few years that has gotten significantly worse over the last couple weeks. She wanted to know, is this a big problem? Do I need surgery? What can I do about the knee? We did do a set of x-rays, and just as a little review, we kind of go over what we see. And in her knee, so this is her left and her right knee, we see a little bit of joint space narrowing, a little bit of osteophytes or bone spurs starting to develop on each side. We're going to see a couple of different views of this as we go. And just to get you oriented, what we have is our femur coming down, sit on top of her tibia. Our patella sits in between the bones. It's going to glide over the top on cartilage to cartilage so it can slide nice and easy. So in the picture on the right, we've taken away the patella to give you that space to see how the round condyles of the femur match up with the plateaus of the tibia. And an x-ray with some nice little arrows a little blurred out shows that medial joint space narrowing tends to get lost on the most weight-bearing side, which is the inside of your knee. As we have that space getting smaller and smaller, that's one of those signs of degeneration. So once again, picture on the right shows the femoral condyles, nice round balls sitting on top of the tibia. We've got cartilage in between. The picture on the left is showing the condyles with those meniscus in between as that cushion, and the ACL and PCL in the middle. Her x-ray did have a little bit of that joint space narrowing. It's not super severe, but it's getting into the degenerative stage. On the side view, we see a little bit better view of that patella. So now you can see how pointy it's getting up towards the top. It looks a little bit more roughened, signs of degeneration of the patella. The patella is that little bone that sits in between the quadriceps, patella tendon, patella ligament that allows that force to be transferred from the quad to the lower leg for leg extension. So the patella is actually pretty cool. It's got a little V shape on the bottom. Here's the front as you would look at it. On the back side, we see it's not a perfect V in the middle. It's a little bit of an offset V, which is why we tend to get a lot of that chondromalacia patella or that cartilage irritation underneath the kneecap with activities that involve a lot of jumping, starting, stopping, or exploding. And going back to that side view, just to get another angle at it, we have those round femoral condyles sitting on that tibial plateau. We have the round condyles, tibial plateau, and the patella up on top. We're getting a little bit of a thinner bone. With some of the age increase, we can lose that bone density. This one might be working towards little osteopenia signs. Osteopenia isn't a great thing to be able to see on top of an x-ray. So that's why you go back to the bone density for a much greater and better measurement for it. So here we have the muscles on top. And what we're looking for in that patella, here's our little offset V shape. We see that little rough and pointy edges. We get a better view of that femoral, the femur, and the osteophyte growth, and we see how roughened that patella is up on top. So once again, not so smooth. We're getting pointy when we shouldn't have pointy off the edge of the femoral and the tibia. So the first question is this horrible? No, this is a common need that we're going to see all the time with an older age group. We have a little bit of degenerative changes in all three zones of the knee, the medial compartment, the lateral compartment, and that patella meeting the femur. We know they have a little bit of cartilage, a little bit of meniscus thinning and wearing because of how it's compressing down. This is a knee that's very treatable, that should do really, really well with conservative therapy. With conservative therapy, we're talking Shockwave to help break up some of the scar tissue, help trigger some of the healing and repair along all the muscles, tendons, and ligaments around the knee. Use a little Graston Technique, especially along that femur and tibia, where it's a little tender as of today when she was in, but can start to feel the difference. We have very strong 15-watt class 4 laser that's going to help decrease some of the pain and inflammation in and around the knee, and then we're going to build towards our exercises. We started with some stability exercises, just a 2-foot balance, a modified balance, getting onto a single leg, and we're going to increase flexibility as we go in all the muscles that cross the knee. So part of the injury progression is going to be going after the muscles, the scar tissue that develops from a lifetime of wear and tear. On the far left, we have nice and healthy muscles. With any time that tissue gets overwhelmed, we go through a healing process where the body slaps down some scar tissue, gives it kind of a quick patch that it plans to come back and fix later. Well, sometimes it doesn't and leaves some of that patch there forever, and that becomes a pain source and also problematic. So Shockwave is a nice, easy way to begin breaking down some of that scar tissue and re-triggering the healing that should have happened. Basically, we're irritating the tissue to bring some more handyman or fibroblasts into the tissue to get them working to get the problem solved. And many times we have soft tissue that just didn't heal right, and it becomes a chronic pain source. So this is the more elaborate view showing good healthy pathway versus sometimes we get that scar tissue that hangs out and just hasn't properly remodeled and creates more of a pain and inflammatory source. We can also take Graston Technique. We're going to slide along the outside of the tissue, trying to mechanically break up that scar tissue, that tendinopathy or tendinosis that forms from years of wear and tear, and re-trigger proper healing in that older knee. Graston many times we describe as an onion. We're trying to take that top layer of the onion or the scar tissue and rip that off. We're going from top down. With Shockwave, we're stomping on that onion to help break up a little bit all the way through it, trigger the healing response. So it becomes a little bit of we start the top, work our way down, and a little bit inside out, makes the process more comfortable, more effective, and more efficient. The balance exercises that we started working with were 2 feet together, offset tandem to a tandem, and then to that single leg stance, teaching that ankle, knee, and hip to work together to stop causing excessive strain on that knee. The laser is shutting down pain and inflammatory processes that are going around the knee. It's also going to ramp up that healing activity a little bit more. It's further getting those fibroblasts to go faster and faster so we can get more progress. Eventually, we're going to shift to some unstable platforms, unstable surfaces, from foam with that 2-foot tandem single stance to getting on the Bosu ball, doing some type of exercise, or even a vibration plate to make the activities a lot harder. We're going to add some bands, some work and strengthening exercises she can do not just in the office, but more importantly at home. You have to be able to do these same exercises at home. If you don't have to come in to me and see specific equipment, you're just not going to do it very often. So that's why we match up as many home activities as possible so that you're getting more gains on your own and spend less time in the office. Eventually, we'll move to more of a deep squatting with 2 foot, and then once again progressing to a single leg as she's getting stronger. And flexibility, as we said, calf flexibility is one of the most important. That calf crosses the knee joint. It affects how much it moves significantly, but it also changes how forces are coming across the knee. A tight calf, people have a tendency to shift their force, shift their gait, shift their movements to overload that knee tissue. If we can get the calf more flexible, we can change the stress loads across the knee, and we can also get the muscle to absorb the forces and not the joint. I'm always big on what are the next set of treatments. If this plan A isn't working, what else can we do? So very commonly, our next set of treatments that we are going to talk about are acupuncture. Some patients do really well with acupuncture. Some people do better with steroid injections, especially if the knee is really painful right now, or gel injections, that hyaluronic acid to put a little bit of squish and space in there to take some pressure off. All of these are treatment options for patients, and we go through what can work really well for them, help them decide, help them get to people who can provide better and additional treatments along the way. Soft tissue treatments are really a part of the solution to help get the knee improved. We're trying to build that pain-free range of motion, to get the flexibility, get the strength, get the endurance, to finally get that joint stability to increase your functional goals and activities, to get you doing what you want to do pain-free and without worry that your knee is going to break down and you're going to need a knee replacement surgery. Hope this information is of value. We have a knee treatment guidebook in the office or on Amazon that you can pick up for more information. And there's a ton more information on our website, robertsonfamilychiro.com, on knee treatments and injuries. So once again, I hope this information is valuable. Please like us and share this with your friends. Have a great day.